I am Dr. Amar Shinde from Jagruti Rehabilitation Center. Today I am going to talk about dual diagnosis. So what is this dual diagnosis? Usually when we admit substance patient with psychological issues or any psychiatric patients, usually they are admitted under one roof in Jagruti Rehabilitation Center. And people always ask questions, why substance patients, alcohol patients are admitted in Jagruti Rehabilitation Center, and while there are psychiatric patients as well with that. So after so many years of practice, we have seen there are a lot of problems in substance use disorder. Almost 50 to 60% of substance use, alcohol use, or any cigarette, nicotine, or cannabis, these people are having some this or that type of psychological illness. So what type of psychological illnesses or what type of psychological problems? So we got some interesting observation in people with psychiatric illness symptoms in substance use disorder. So first important thing is psychosis. So particularly it is very common in hallucinogen addictions, it is very common in cannabis dependence, it is also common in alcohol use, in which they are also having almost schizophrenia-like symptoms. And sometimes when there is no family history of schizophrenia, the illness start later after the initial use of the substance, then there is a confusion in our mind, what is this, whether this patient is having schizophrenia. But according to me, they have used substance first, and after that the psychiatric or schizophrenia symptoms started. That means they are having dual diagnosis, means there are two types of problems. One is substance abuse or dependence, and second is the psychosis. And it is interesting that this patient recover very fast, and the recovery rate in this patient is more better than schizophrenia patient, and they have to stick to the treatment and they have to go away from the substance. Second problem in these substances, there is a change in personality. So sometimes the normal family background, social background, business background, academic backgrounds, they suddenly go away from these things and they start thinking separately. They even talk about philosophy, they talk about spirituality, or sometimes they are not real. That is called as pseudo-philosophical talk in this patient. Third problem we are finding in this patient is a motivation. After stopping of the substance, they are not motivated to do any activity. And other problem we are finding in some alcohol or other addictions, there are certain personality issues in these patients. Particularly, we can find cluster B personality traits, in which they are having sometimes borderline personality, antisocial personality, or any anxious dependent personality. They are getting excessively dependent on the drugs because of their personality factors. Along with that, all the other psychiatric illness, like we have found OCD in some substance use patient, we have found mania in substance use patient, bipolarity is there. Almost all psychiatric illness are there with the substances. So whenever we treat any addiction patient like alcohol addiction or any other substance, we need to understand their underlying problems. There may be some underlying personality problem, there may be some underlying psychiatric issues. If we treat the underlying psychiatric condition, the results of the addictions will be much better. And that's how our Jagruti Rehabilitation Center are working. We are treating substance detoxification, de-addiction, along with the psychiatric treatment, and that is causing a lot of improvement in the people, and our result for the de-addiction treatment are wonderful. I think everybody should follow this line of treatment, and hence the addiction patient will definitely get mental health in this, and the results will be good. Thank you very much.